Good day, I'm Sr Sureta from Zest Wellness. I run a private nursing practice conducting services to patients that may require assistance in slimming, health or wellness, and medical beauty, for example acne, pigmentation and or scarring treatments, as well as anti-aging. Pathology services and intravenous therapies are also available at Zest, as well as nursing consultations and some vaccinations. I have a special, passionate interest in female health care. I also refer patients to medical practitioners and or specialists if and when needed. I am also a life coach with focus on holistic well-being. Today we're going to talk about contraception or family planning, also named as prevention therapy or birth control. Family planning or birth control plays an important role in the young adult female since it became available in the 20th century. It may also be referred to as contraception or fertility control via methods or devices being used to prevent pregnancy. There are 6 types of contraception. The first one will be our hormonal methods. Hormonal methods get divided into 2 different sections, namely birth control pills or injections. Birth control pills are normally a 28-day cycle pill consisting out of 21 active days and 7 inactive days. There are 2 types of pill options available, the combined pill and the progesterone-only pill. Talking about injections, we again get 2 products. The 12-week injection called Depo-Provera, which is the long-acting product, and the 8-week injection called Neostrate, which is short-acting. The second type of contraception will be the long-acting contraception, or called the intrauterine device, also referred to as just an IUD. We get 2 types of IUDs, non-hormonal and hormonal. The non-hormonal, also known as the copper T or just referred to as IUD, but also well known as the Nova T. Then when we talk about the hormonal IUD, it will be either the Mirena or the newly launched Kyleena, which is a progesterone-coated IUD, and also lately there is the Implanon NXT, which is subcutaneous implant in the upper arm, but it is not an IUD, it's not an intrauterine device. The third contraception method is called the barrier method, where the people make use of male condoms, female condoms, or the vaginal ring. For example, the Nuva ring, which again is hormonal coated, and or spermicidal foams or gel. All of these will prevent sperm getting through to your cervix and or into your uterus, which will prevent conception. The fourth family planning or contraception method will be the emergency contraception, also called the morning after pill. This pill needs to be taken within 72 hours after unprotected sexual intercourse or a broken condom. This prevents the sperm fertilizing a possible egg. The fifth method is called the fertility awareness method. This is when sexual intercourse gets planned according your menstrual and or your ovulation cycle in order to prevent or plan a possible pregnancy. Various options are available. For example, taking your basal body temperature daily, where we will find that the body temperature will rise during ovulation, which will help you to plan pregnancy or prevent the possible pregnancy. Secondly, you can make use of your monthly calendar literally or via a female application from Play Store, also called the rhythm method. It is well used these days, especially for people to plan their menstrual cycles accordingly. The third method can be your cervical mucus method by checking your cervical secretion daily before and after urination, but this is not an often or well used option anymore. The sixth or last method for family planning or contraception will be permanent contraception. Again, we get 2 methods. Number 1, male vasectomy, where we sterilize the male, and secondly, female tubal ligation, or as well known, sterilization. When should one start contraception? The moment you become sexually active or are planning to go into a relationship that will involve intercourse. Consult with your clinician which method will suit you best. Contraception is also important after the birth of a new baby. This will prevent surprise or unwanted new pregnancies. Remember your annual pap smear once you become sexually active and thereafter. Important to remember, some birth control pills are time sensitive and should be taken more or less the same time every day. Make sure to check with your medical practitioner or registered nurse. Some medications, for example, certain antibiotics, even antifungal medication, anti-seizure medications, stimulants and even over-the-counter products may interfere with the efficacy of your birth control pill. Always make sure to inform all medical professionals regarding your birth control, even homeopaths and natural clinicians. Using contraception will not protect you from sexual transmitted diseases or contracting HPV, human papillomavirus. Thus, always consult with your medical practitioner or gynecologist when you are in doubt, want to stop any method or change any method, want to fall pregnant or need some advice. The take-home message of this video is, birth control plays an important role in the advancement of women in the workplace, allowing them to invest in their careers and plan for their futures. Thank you.